Can UCR charges lower your medical bills? Imagine you're facing a big medical bill after a visit to an out-of-network doctor. You might wonder if there's a way to lower that cost. One key tool in managing medical expenses is understanding what are called usual, customary, and reasonable charges, or UCR for short. These are benchmarks used by health insurance companies to decide how much they will pay for a service based on what most providers charge in your area. The UCR amount reflects what is considered a typical fee for a procedure in your geographic region. Now, UCR charges don't directly lower your bills. Instead, they set a limit on what your insurance will cover for out-of-network services. If a provider charges more than the UCR rate, you are usually responsible for paying the difference, which can make your bill higher. But if the provider charges at or below the UCR rate, your insurance is more likely to cover its part, leaving you with a smaller out-of-pocket expense. It's helpful to know that UCR usually covers about the 80th percentile of what providers charge in your area. This means most providers charge at or below this rate, but some may charge more. If you notice a bill that seems excessively high compared to the UCR, you can use this information to negotiate. Patients or advocates can contact the provider and ask if they are willing to lower the bill to match the UCR or a similar reasonable rate. Sometimes, providers agree to reduce charges to avoid billing disputes or delays. For in-network providers, charges are often negotiated beforehand and tend to be at or below UCR rates. This helps keep costs predictable and often lower for patients. When dealing with out-of-network providers, knowing the UCR can be a powerful tool. It gives you a benchmark to challenge bills that seem inflated. If a bill exceeds the UCR, you can request an explanation or negotiate a lower amount. Insurance companies use UCR charges to prevent overpayment and control overall healthcare costs. They do not automatically reduce your bills but help define what is considered a fair payment for services. By understanding UCR charges, you can better manage and negotiate your medical bills, especially when out-of-network charges are involved. Remember, always consult your healthcare provider and insurance plan details, as policies can vary. Using UCR as a reference point can help you avoid overpaying and ensure you are billed fairly based on typical regional costs.